Since Rajesh sir is a radiologist, we have 24/7 ultrasound, and I think anybody in South Bangalore first ring in any hospital date comes to Rajesh sir, even in the midnight, even on Sundays, even on festivals, even when it is raining heavily, he is the first person of contact for any corporate hospital till date, even if we are having our own setup. Still, he is the person who goes and scans the patients first.
See, the problem in Bangalore, after 8 p.m., everything shuts. So, even to get a simple ultrasound, people will be roaming all around Bangalore. So, people who have in Jainagar, Baswangudi, Hanuman Nagar and Banshankari, they all know me, so they can call me directly. So, I will be available. So, but some areas, they don't know where to go. And they will be roaming the whole night.
Recently also we had a patient from Chatpatna who roamed the whole night and 2 a.m. came to our hospital 2 days back. She was not feeling the baby's movements. She was traveling all around the place in Bangalore from almost like evening 7 p.m. till she reached the hospital at 2 a.m. in the morning. Then we have a very good urology team which is headed by Dr. Nagbhushan. Our dialysis center is 24/7 working. We are I'm taking pride in announcing that all our beds in the ICU have 24/7 dialysis facility, which means the RO line is running to all the 8 beds in the hospital. Like if you want in any corporate hospital a dialysis to be done in ICU, you need to do the shifting of beds. Like suppose say you are in the non-dialysis bed, they need to shift you. That facility also we have given here, that the patient can sleep in the same bed and get the dialysis treatment then and there itself without any shifting of ventilator or the oxygen lines or the IV lines or anything. This was much planned by Dr. Rajesh earlier when he found in various corporate hospitals that was the problem when he went for the scan and all that stuff. He was seeing so many people there shifting beds just because one ultrasound radiologist had come to do the scan on a kidney patient. They wanted to shift the patient to the normal bed, again shift back them to the dialysis bed, again shift back them to the normal bed. It was so messy there. So we equipped the ICU, all the beds with the dialysis facility. Then bariatric surgery and cosmetology, of course this is the most hot one now because of as Dr. Pawan said, we have a very bad lifestyle and the present day what we are eating is not so very good. So we have lot of people with obesity and a lot of mom makeovers. This is I think because of the media or whatever, and the people who are entrepreneurs, lady entrepreneurs are coming up with after delivery, whatever the earlier shape that they want to retain that shape because of the corporate culture and the world and what they are wearing, and they want to be looking more young and all that stuff, and that brings a life to this place. We have a team headed by Dr. Rakesh and Dr. to do baby mom makeovers.
అంటే ప్రెగ్నెన్సీ అయినాక అందులో సన్నగా కావాలి అడుగుతా ఉంటారు ఇప్పుడు.
సన్నగా అయ్యేది కాదు, దే వాంట్ టు టోన్ అప్ దేర్ మజిల్స్, దేర్ టమ్మీ డజంట్ వాంట్ టు షో అప్ సో మచ్. అక్కడ థై దగ్గర ఫ్యాట్, దెన్ ద ఆర్మ్స్ దగ్గర ఫ్యాట్, దే ఆర్ సో మచ్ వరీడ్. Especially housewives కి a worry ఉంది, but they don't bring it out so frequently. But corporate world, if they are wearing suit and they are walking around, or if they are wearing western dress, they get very conscious about their thing, and they are not coming up with so much of efficiency as what they were used to earlier. And this pregnancy has to be accepted because it's a natural thing. So ఇప్పుడు mummy makeover sana అయింది, so we are part of it. And the joint replacement and arthroscopy, just because we are all turning 50, I wanted Dr. Pawan to come and give a lecture about joint replacement and other things. Then physiotherapy, we have excellent neuro rehabilitation, and we run rehabilitation for senior citizens also with a very low budget. Like suppose say you have a grandmother or grandfather at home and all the people are working, you need to hire at least 2 nurses. to handle, because you don't get 24/7 nursing. Either you have to have 2 nurses, or nowadays there are people who are coming from Udupi and that stuff, they stay at home. When they stay at home, you are bothered about your belongings also, like how to leave them alone in Manindlu anta unte దీనికి ఎట్లా వాళ్ళు నిలిచిపోయేది, అవాతాతల దగ్గర ఎట్లా వాళ్ళు నిలిచిపోయేది, ఆర్ యూ హ్యావ్ టు క్యారీ దెమ్. ఇట్ ఈస్ బికమింగ్ ఎ టఫ్ థింగ్. సో ఏం చేస్తాము అంటే మనకి అట్లా వాళ్ళు ఉండేవాళ్ళు, వీఆర్ కీపింగ్ దెమ్ అట్ 2 beds ఉండే దగ్గర వీఆర్ ఛార్జింగ్ దెమ్ లైక్ 35,000 అంతే పర్ మంత్. అండ్ వీఆర్ ప్రామిసింగ్ లైక్ కంపల్సరీ డాక్టర్స్ విజిట్, 24/7 ఇది ఆయాది వార్డ్ బాయ్ది ఫెసిలిటీస్, ఆమెకి వాళ్ళకి బెడ్, వాళ్ళకి ఫుడ్, దీస్ మచ్ విల్ బి కవర్డ్ ఇన్ దట్ 35,000. అది ఇంట్లో మనం చేస్తాను, ఐ డోంట్ థింక్ వీ కెన్ మీట్ దట్ ప్రైజింగ్.
It is more what is happening, the elderly population is having lot of issues, health issues, and other family people are all working. So at home they are left, and they might feel a little more if they are in the medical care, they will be a little more happy and safety. That is why they suppose they fall down or something, that is all in their mind, that something happens like that. So that is why we thought that the geriatric care center should be in the hospital.
Should be in the hospital, not as a geriatric care. Man old age home tara ankoradu, dani they will not get 24/7 facility, but we have treated like more than 12 patients now. Surekha is in charge of that. More than 12 patients we have treated, and there is one patient who is constantly staying with us for the past 4 months.
And
మా దగ్గరే ఉంటారు వాళ్ళు.
And ఏమైతా ఉంది ముస్లోళ్ళకి all the organs they slowly they come, they don't work properly. Kidneys problem undi, brain ఉంటుంది, heart problem ఉంటుంది. So all the specialists are anyway they are coming here every day. So whatever they want, we can give them the consultation also.
But that consultation we will charge extra. But at least మనకి తోడుకొని రావాలా, వాళ్ళకి చూపియాలా, డాక్టర్స్ వెయిటింగ్ టైము అదంతా లేదు, వీళ్ళు వచ్చి చూసుకొని పోతా ఉంటారు. అది నువ్వు ఇచ్చినాము, అండ్ ఇట్ ఈస్ నో లాస్ నో ప్రాఫిట్. అది దట్స్ as a kind of service. Yeah. No loss, no profit. Then we have started our home care facility almost like 8 months back. ఇప్పుడు ఎందరో జనాలు మాతో వచ్చి హోమ్ బ్లడ్ కలెక్షన్ నడుస్తారు. మనకి ఇంట్లో ఎల్డర్స్ని పెట్టుకునే వాళ్ళు, జాయింట్ ఫ్యామిలీ ఉండి పెట్టుకునే కెపాసిటీ ఉండేవాళ్ళు, వాళ్ళకి హోమ్ కేర్కి, కెథెటర్ కేర్కి, డ్రెస్సింగ్స్కి, బెడ్ సోర్కి, మనకి రైస్ ట్యూబ్ ఫీడింగ్కి, ఇంకేమైనా ఇంజెక్షన్స్ వాళ్ళకి వేయాలంటే, షుగర్ టెస్టింగ్ అదంతా ప్రాపర్గా చేయాలంటే, దానికంతను వీ హ్యావ్ పీపుల్ హూ గో అరౌండ్ ద ప్లేస్. అట్లీస్ట్ వీఆర్ కవరింగ్ 15 kilometers. Surekha?
Yes, we are covering.
15 kilometers we are covering, and any call to Dr. Rajesh or to the hospital numbers, our people will be there within half an hour depending upon the distance.
Super.
And as a tribute to my mother-in-law and what services they have, we have put our free diabetic clinic on every Tuesday. ఎవరైనా రావచ్చు, ట్యూస్డే ఎవరైనా రోడ్లో ఉండే వాళ్ళు కూడా వచ్చి మన దగ్గర, యాజ్ డాక్టర్ పవన్ సెడ్, డయాబెటీస్ ఇస్ సచ్ ఎ కిల్లింగ్ డిసీజ్. FPS, PPBS డాక్టర్ కన్సల్టేషన్ ఫ్రీ ఉంటుంది. అవద్దు
every Tuesday.
అండ్ దెన్ నేను గైనకాలజీ ఉండేదాన్ని. ఇంకా దిస్ ఏరియా ఈజ్ మోర్ ఆఫ్ లిటిల్ లోయర్ మిడిల్ క్లాస్, సో ఐ వాంట్ టు గివ్ ద బెనిఫిట్ ఆఫ్ my specialty to so many other lower middle class people. So I have run my free consultation only for BPL patients on Friday. And ultrasound and lab test will be done at 50% discount. అంటే ఇప్పుడు మన ఇంట్లోనే ఎందరో జనాలు వంటోడు పనిచేస్తూ ఉంటారు, పన్నోడు పనిచేస్తూ ఉంటారు, మనకు వాచ్మెన్ ఉంటారు, డ్రైవర్లు ఉంటారు, వాళ్ళకంతా దే కాంట్ అఫోర్డ్ బెటర్ కేర్. మనకి ఒక్క కాల్ అవే, మేడం మా డ్రైవర్ పంపిస్తా ఉన్నాను, వాడికేమో ప్రాబ్లం ఉందంట చూడండి, మా వంట ఆయన పంపిస్తా ఉన్నాను, మాకేమో ప్రాబ్లం ఉందంట చూడండి అంటే, వీఆర్ ఆల్వేస్ దేర్ ఫర్ యువర్ హెల్ప్. And after seeing this, our EAT and our surgeon doctors also extended their help, and off late our dentist also, last meeting he said that he will assure dental checkup also free on Fridays.
Our hospital is tied up with all the insurance companies, so anybody is having all these can have cashless. You don't have to pay anything. Star Health, HDFC, ICICI, and
Star Health Insurance, HDFC Ergo, Tata AIG, SBI General Insurance, Future General, ICICI Lombard, Care Health, Reliance, Niva Bupa, Safeway, Ericsson. ఇది అంతా ప్రైవేట్ ఇన్సూరెన్సెస్, ఇది నాట్ ద జిప్సా ప్యాకేజ్ అంటే నేషనల్ హెల్త్ ఇన్సూరెన్స్, యునైటెడ్ హెల్త్ కేర్, రక్షా టిపిఐ ఇదంతా వచ్చలేదు. బట్ మోస్ట్ ఆఫ్ అస్ ఇంక్లూడింగ్ మీ టిల్ డేట్ హ్యావ్ నేషనల్ ఇన్సూరెన్స్. So we have tied up with a third party company who can process these insurances for you. One దగ్గర direct గా cashless అయ్యలేదు, but we have tied up with somebody who can do the cashless for you. Yashaswini aita undi, but the prices that they are offering is very low, and to be behind them and to get the money back, I can tell, I think we are still short of 7 people who retreated during COVID to get back from the government. కోవిడ్ టైంలో మనం గవర్నమెంట్కి ఇచ్చిన దాంట్లో ఇంకా 7 bills ఆర్ స్టిల్ పెండింగ్. వాళ్ళు ఇచ్చే జనరల్ వార్డ్ 5,000, ఈవెన్ దట్ ఈస్ పెండింగ్ టిల్ డేట్. సో ఇట్స్ వెరీ టఫ్ అంటిల్ అండ్ అన్లెస్ యూ హ్యావ్ సమ్ కనెక్ట్ టు ద హైయర్ bureaucracy over there to get Yashaswini schemes and all is little tough. We are trying for CGHS and ESI, but I think by next year Jan we will get ESI and CGHS, Central Government Health Scheme. But Yashaswini, Arogya Bhagya, Arogya Shri, idantha saana kashtamundi. They give just, I think she knows better, they give just 10,000 rupees for a C-section. Medicines, pediatrician, anesthetist, gynaecologist, 3-day rounds, room rent, ఎక్కడ చాలా అవుతుంది. 3 దినాలు వాళ్ళు పక్కన హోటల్లో తింటే వాళ్ళ ఇంట్లో 3 జనాలు అవుతుంది. నాట్ అప్రోప్రియేట్. And that too, you have to be behind them to get that money back, and you have to bribe them heavily to get that insurances. It doesn't work for us. But for that benefit, we have given we have a free ward with 2 beds actually. That is started by my father-in-law only as a tribute to his father. To have 2 beds in the free ward. We give our own medications. We request, if it is my specialty and Dr. Rajesh's specialty, we do it free of cost. If it is some other specialty, we request them to bring down their consultation fees to the minimum. And we have 2 beds still in this hospital also to cater for poor people. Anyway, we are doing our Friday consultation free, and we are charging our lab and scan 50%. And in case the patient is poor and is we should feel that patient is poor. It is not that he should say that patient is poor. Then we give free service. We give free service. We have done almost like camp patients. So వీళ్ళదే ఒక ఆర్గనైజేషన్ ఉంది. అక్కడ ఇంకా క్యాంప్ పేషెంట్స్ గర్భకోశం తీసేకి, ఆమెకి హర్నియాకి, ఆమెకి హిప్ రీప్లేస్మెంట్ ఫ్రమ్ జస్ట్ డయల్. హీ రిక్వెస్టెడ్ ఫ్రమ్ జస్ట్ డయల్ టెలింగ్ దట్ ఐ హ్యావ్ ఓన్లీ 30,000 rupees, కెన్ యూ డూ హిప్ రీప్లేస్మెంట్ అని. దిస్ వాస్ ఇన్ ద ఫస్ట్ 6 months ఆఫ్ ద హాస్పిటల్. అండ్ డాక్టర్ రోషన్ అని వాళ్ళు పెద్ద రాలే. ఇన్ఫాక్ట్ ఐ రిక్వెస్టెడ్ డాక్టర్ రోషన్ టు కమ్ అండ్ గివ్. హీ సెడ్ లెట్ డాక్టర్ పవన్ కమ్ అండ్ కవర్ అప్ టుడే, ఐ యామ్ హెల్డ్ అప్ అంటే. హీ డిడ్ ఇట్ at 30,000. Hip replacement. In any corporate today it is 3 lakh rupees.
A quick question, what is IVF? What is the expansion? Very good. So what does it mean? What does it mean? Yes. Yeah. Thank you, Ashwin. Now,
and quick interesting surgical cases. This is Rakshita, 13-year-old, laparotomy plus cystectomy. Idi EMki pancreas lo cancer undi. 13-year-old suffering from a pancreatic cancer. She has been roaming around. If I am allowed to permit to tell the names of the hospitals that they have roamed around? No? Okay, fine. ఎన్ని జాగాలకి కార్పొరేట్ దీనికి పోయింటే హెపటోబిలియరీ సర్జన్ లేదు ఆపరేషన్ చేసేకి అని 1.5 months they are waiting for a hepatobiliary surgeon to get the thing done, and she got discharged 4 days back. We did about 5 hours in the surgery. She received about 8 bottles of blood transfusion, 6 bottles of platelets and 4 bottles of FFP. She stayed in the hospital for 19 days, in the ICU for 5 days, but she recovered very well and she left.